Union's partnerships with businesses, educational institutions, and nonprofit organizations remove learning obstacles by providing our community schools with enrichment opportunities and needed ancillary support, such as extended learning days, adult education opportunities, and on-campus medical care for the entire family.
How are you? I'm a doctor, again, working for OU. And I'm in the school, but I have appointments and I see patients from anywhere. And so if there's a child in the school that gets sick, they still go to the school nurse. But if they're our patient, they can maybe get an appointment that same day, where their parent comes, and I can see them that same day in the school.
We partner really well together. There's a lot of times when I have a parent that may come in and she may know the parent, and it kind of helps relax the parent. And we start talking about the clinic, and she gives information about the clinic there. So it kind of makes it more comfortable, I think, for the parent walking in.
Or I can give suggestions to the parent why this would be good for your child to be enrolled in the clinics, and things that I know about the family without saying too much. It just lets them know, oh, this might work for me.
We have interest forms that come in from the schools and sending them out, so I try to call those people. Celeste has recommendations all the time. If she feels like there's a family, she'll talk to them and let them know that we have the clinic here, and then I can reach out to them and give them a call and go ahead and get them set up.
Sometimes as a parent comes in, they'll be talking about, what am I going to do? You just called me, my son has asthma, I don't have any medicine. And so I'll talk a little bit about their health care. Do they have it? One family recently I knew had moved here from out of state, and I didn't know if they had health care yet, so I offered our clinic, and it turned out she didn't have just 3 children, she had 5.
Yeah.
And so I gave her name and number to Bridget, and they got them enrolled, and they're all very happy. Well, since I'm at the RN at the school, they come into me for their health needs, or their runny nose, or their stomach ache, and I check them out and do my assessment, and they either go back to class or they rest, or sometimes I end up calling the parent, and many times my interaction results in a referral to Bridget.
And if that interaction also, if the parent happens to come up and the child is needing a doctor, then we can talk to them right then, and usually we can get them into the clinic. We have an opening, and that way they don't have to go home and then come back the next day. We try to get them. So that interaction right there, I think, helps them to see that the clinic is here and it's got a purpose, and they can have a medical home here, primary care here. So.
And the quick appointments they like too, very well. I think they feel like that we really care about their children. Mm-hmm. And there's 2 people talking to them and saying, we can help you, we can do this. And then we act upon it right then.
Mm-hmm. I know for us as the clinic, we have to understand that we're a guest within the school, but we also need to be able to work in partnership with our school staff, and especially the school nurses, because they're a great resource for us. So getting involved in that, you have to understand that there needs to be open communication, there needs to be collaboration, and it doesn't need to be just just the clinic or just the school. It needs to be able to work cohesively, otherwise it's not going to be successful.
Even as something as simple as whose printer is working right now, or is this school paper or is this clinic paper? We just are very cohesive here. We just work together well. We work together under chaos and school children mixed with patients coming in, and perhaps their family members that are there, and everybody kind of has their little chair and desk, but we're all flexible. If we notice someone sitting in it, we just move on and just work around each other.
Our staff here and at Roy Clark are bilingual, so that helps. We have a doctor on staff that's bilingual, so I think that helps a little bit, again, talk about making patients comfortable. To making the clinic successful, we are open to the entire community. We're not just for the school, we're actually open to the community around here. We also work collaboratively with the school. So when I come into the school, I don't feel like I'm going to the OU clinic and it's just me and my OU staff. I feel like I have an entire family of resources here that I can utilize, from the principal, community coordinator, school nurse, counselor.
If you're going to call yourself a community clinic, that you are a full community clinic, as in she said, opening up to the elderly, to the grandparents, to the moms, the dads, doing what you can to help them. They give a lot of referrals if this clinic doesn't cover what an adult needs, and being welcoming and available. If you're going to be a 10 to 2 clinic on 2 days a week, that's not a good idea. If you're going to be 8 to 5, Monday through Friday, lunch hour, that's a good idea.
When we have events, if we're able to educate in any way and be a part of school events, that's a great thing too.
One thing that Bridget has tried to do is attend the nurse meetings each year and hand out the information. Please use the clinic. This is when we're open. She's very available if you have someone who might need health care. And there was another school nurse that called and said she had a child who was not taken care of. His asthma was not in control. So she referred him to me. She gave me a call. I told Dr. Witt, I believe,
Yes.
and you guys, Bridget, and they got him in, and he is now well under control. The nurse was so grateful. She sent a thank you note to Dr. Witt because she feels like, and she said in the thank you note that she thought that the clinic really made this mom seem to understand the importance of the prevention of asthma. And before, it seemed like the nurse wasn't getting anywhere. She was the only one saying it. And the mom just wasn't sure in her grasp of the disease. And she felt like after this mom had been to the clinic, that she really started taking care of her child. And she was grateful.